Hi everyone, my name's Professor Gill Thomson. So I'm just going to provide a short presentation to tell you about some of the work that we do within the MAINN research unit and about how our work really emphasises the importance of connections and relationships. And here's the MAINN team. And MAINN stands for Maternal, Parental and Infant Nutrition and Nurture. And so from the left to the right, we have Lucy, and then Anastasia, and then there's me, Nicola, Rebecca, and Victoria. And we're quite an eclectic mix. So we've got a number of us. So Lucy, me, and Rebecca have got psychology backgrounds. We have Anastasia, who's some bio engineer, so does some very clever work looking at thermal imagery and kind of bodily movements during the labour process. We have Victoria, who's a nutritionist, and then Nicola, social science. So our work tends to centre around these three main areas. So first of all, around the delivery of perinatal care. So this includes the work that we've undertaken around antenatal education or women's experiences around childbirth and of infant feeding support. So, for example, we've done a number of evaluations of breastfeeding peer support services, and we also did a longitudinal evaluation looking at implementation of the Baby Friendly Initiative. Our work also goes into parental and family mental health, wellbeing and social relationships. So over the last couple of years, we've been doing an evaluation of one of the new reproductive trauma services. And this is quite an interesting model in that there's one service that actually provides support across 4 maternity trusts in Lancashire and South Cumbria. We've also done work with a number of charities. So, for example, Lancashire Women, who've been doing bedside support for parents whose babies have needed care on a neonatal unit. And the other area is around maternal, infant and young child feeding and nutrition. So this kind of overlaps with a lot of the infant feeding and breastfeeding work we've done, but also kind of draws on the expertise of Victoria, who's done a number of nutrition related projects and in low income countries such as Pakistan. So I'm just going to give a bit of an overview of some of the projects that we've done or that we're doing, and about how they link in with this kind of underlying focus on connections and relationships. So I think first to highlight, we've done lots of research and evaluation into peer support within different contexts. So around infant feeding, for parents who've had an infant admitted to neonatal care due to being born premature or sick, peer support for women following birth trauma, or for women who have histories of interpersonal violence and harm. And peer support is defined as receiving support from someone who has a shared history and who's received some training to provide this support. So rather than it just being someone who you already know within your network, it's someone who's been identified, trained, supported to provide peer support. And I say this work repeatedly highlights how peers who understand, your realities can help to normalise negative emotions and provide reassurance, validation and hope to their situations. Peer support is really valuable in improving psychological and emotional well-being and increasing individuals' social networks. And we're currently working on a new model of infant feeding peer support that involves an asset-based approach. And an asset-based approach focuses on identifying the strengths and resources and capabilities of individuals and communities. So rather than concentrating on needs or deficits or problems. So in this study, we're using a friends and family diagram. So this is whereby the peer supporter works with the woman to kind of create a visual diagram about who's available to them within their own personal and social networks to help them with infant feeding, and also giving women an assets leaflet, which gives them all details about what is available within their communities. So this is, we actually had funding for a feasibility study, and this is a multi-centre trial. So we are literally, hopefully, well, within the next month, going to find out whether this was effective. So it's been a very exciting project to be involved in. You know, we've done 2 evaluations of the National Breastfeeding Helpline. So there was one, I think it's about 2012, 13, and then we did another one like 10 years later. You know, and again, this highlighting about how these peers are a lifeline for parents. So those who are at home and struggling to access support, you know, and actually being able to receive support from new mothers via telephone or social media who understand a wide array of infant feeding situations and experiences, you know, is invaluable. It helps to reduce stress, increase knowledge, confidence. You know, for a number of those who access these services, it makes a crucial difference in breastfeeding continuation. And we've also done some really interesting work looking at the use of incentives to breastfeed, and this is quite controversial. I know there was a big study undertaken in, I think it was from Leeds, looking at kind of giving women monetary vouchers. But this was a different type of incentive. So it was working with the Breastfeeding Network, and they provided new mothers with a series of gifts, such as a photo frame to put in a picture of the baby, so to look at to help them stimulate, you know, milk production, giving them like a magazine of their choice to encourage them to take out, giving them a voucher for like going out to use a cafe for coffee and cake to get them out and about and spending time with partners. But I think what was really lovely about this project is that all the gifts were designed to stimulate and continue breastfeeding through self-care and through connections and relationships. And one of the key things we found when we were doing the evaluation of this project is that the gifts helped to build this stronger bond between the peer supporters and the women. So it's because they were providing gifts, the women were much more likely to invite them into the homes. Oh yeah, come and see me, give me, you know, they liked getting the gift. But because the peer supporters were in more regular contact, they were better able to provide support. They got a better understanding about the woman and their relationship and the family context, so they could give more nuanced, targeted support to help the woman and her family. And Rebecca and the team's also done lots of work around loneliness. And so as part of this, she's been looking evidence summaries and looking at blogs online and trying to get some funding to help develop interventions to to help people who are lonely. I don't know if you're ever going to prevent loneliness, but to help mitigate the kind of negative impacts of loneliness. So parenting loneliness, you know, that many new parents struggle with this transition to parenthood. You know, this can occur as a lead up to the birth, and the first few weeks after the birth are often filled with, birth preparation, people coming round, visitors, that whole adjustment. You've got a new baby to think about. And once things quieten down and they settle into life with the baby, that kind of focus disappears. And this can be when a feeling of loneliness can begin. For many new parents, there's a large contrast between pre-baby and post-baby life. Before having a baby, parents can be busy with work and hobbies and friends and, travel. But once these opportunities for stimulation and interaction decrease, this lack of connection with others can create this sense of loneliness. And this can be even more so for parents who've got children with disabilities or, sickness. So yeah, this kind of evolving area that's been worked on within our team, led by Rebecca. So it'll be interesting to see where this work takes us. And I think just to highlight this, collaboration, connection and relationships also about us as an academic institution, that we always are collaborating with service users and academics and clinicians and voluntary sectors and external businesses and partners to make sure that we have the right skill mix, that we're targeting needs, we have who we need to do the most successful work that we can. So I just wanted to highlight how some of our work is influencing policy and practice. And this is specifically in relation to breastfeeding and infant feeding. So as I was highlighting earlier, within the team, we do some broader areas like perinatal mental health and nutrition, but specifically in regard to this infant feeding agenda, our work sort of heavily influenced the change in the UNICEF UK baby-friendly initiative standards was really this kind of move away from just having a more focus on exclusive breastfeeding to more about parent-infant relationships and the importance of that and kind of protecting parents' mental health. This kind of comes from some of the work that I did about looking at shame as well, the shame that women can feel if they do breastfeed or they don't. Our work kind of underpins breastfeeding guidance within Public Health Wales, within the Scottish Government, the Agency for Healthcare Research and Quality in America, the European Union Agency, so NICE, postnatal care, so some of our work cited in there, and specifically around breastfeeding, and also the Australian National Breastfeeding Strategy. So we're very proud that our work's kind of going on to help influence important, and systemic change. And I'm just going to do a plug for our conference. So next year, we're running our next Nutrition and Nurture conference, and this will be our 12th time that this conference is run. So, well, primarily in the UK, but we have held some of these conferences overseas, such as in America, Sweden, and Australia. So the kind of key aims of the conference are to illuminate socio-cultural, political and economic influences upon infant and child feeding, explore the nature of relationships within families in connection with various types of nutritive and nurturing behaviour, increase the understanding of breastfeeding as a biopsychosocial activity, enhance understanding of the complex interactions between socio-cultural, psychological and biological factors in infant and child feeding, and focus on key initiatives that may impact upon practices related to infant and child feeding. So yeah, the conference is for 3 days running in April next year. So this is where we hold the conference. So it's in Grange-over-Sands, the rather stunning Grange Hotel, and it's a really wonderful opportunity to show our international kind of partners and visitors, who attend the conference, just how beautiful England can be. So finally, I just want to highlight who our keynote speakers are at our conference next year. So we've got Philip Baker, so he's from Sydney in Australia, who's going to be talking about ultra-processed foods, so very topical research area. Cheryl Battersby, who'll be sharing some of her research about how we should feed sick babies in the neonatal unit to reduce NEC, including the use of donor milk. Constance Ching from Malaysia, who'll be talking about the use of artificial intelligence to track WHO code implementation and breaches of the WHO code. Kate Jolly, so she's a professor from Birmingham, so she's the principal investigator on this asset-based peer support intervention I just talked about previously. So she led over this multi-centre trial that was running in 5 areas, and in our team we were the Northwest lead for this trial. So yeah, she's going to be giving all the kind of headline and insights into what we found within this trial. Then we've got Elaine Spate, who's a reader in curatorial practice from my university in UCLan, and she's been doing some very innovative, creative ways in which to promote and support breastfeeding. So she'll be sharing some of this work with us. And then finally, Sarah Young from Northwestern University in America, who'll be talking about her work about, malnutrition and nutritional needs in children and young people. So we have the abstract submission is still open till the end of November, and the conference will be in April 2025. Okay, thanks for listening.